Here's a question. What's the difference between a dietitian and a nutritionist? It's pretty common actually for people to think that these are one and the same, but today we're going to break down both professions and explain why they're very different. Part 1. What does a dietitian do on a daily basis? So as it turns out, quite a lot. Dietitians help to develop diet and nutrition programs tailored to individual or group-specific needs. They're going to stay on top of the latest diet trends and then standardize their recommendations to their patients. But dietitians typically work with more than just individual clients, so they also work with other folks in the health industry. Some examples would include working with doctors to help improve the eating habits of their patients with complex health issues, or collaborating with government departments to create new health strategies for the general population, and consulting with food industry leaders on food sustainability and production. So in summary, some of the duties of a dietitian may include the following: helping individuals make the right food choices, creating diet plans for individuals with certain conditions like diabetes or allergies or obesity. They could also be advising officials on food-related policy. They could be educating individuals on organizing nutrition programs, food safety storage, or diet and drug interactions. Finally, dietitians also conduct nutrition research. So that brings us to part 2. What does a nutritionist do on a daily basis? Dietitians and nutritionists both focus on helping improve the health of others. However, what makes them different is the education and the training that they use. Dietitians typically hold a bachelor's degree in dietetics or a related field. In many countries, dietitians are regulated by professional bodies of government or agencies that are required to be registered or licensed. Now, on the other hand, the term nutritionist is used way more broadly than dietitian, and it doesn't always require a specific degree. Many nutritionists have formal educations and degrees in nutrition-related fields, while others might have just completed short courses or certifications. The other major difference is their focus and approach. So dietitians, on one hand, are trained to provide medical nutrition therapy for various health conditions. They often work with other healthcare professionals to develop nutrition plans that are then tailored to the patient's medical needs, but taking into consideration factors like allergies, chronic disease, and medications. So a dietitian is typically going to work in more of a clinical setting, such as hospitals, healthcare facilities, and private practices. While dietitians have a stronger medical focus, many nutritionists take a more holistic approach. So they're going to be considering additional factors like lifestyle, habits, stress levels, and just overall well-being. Nutritionists tend to focus on general health and wellness through the diet and lifestyle change lens. So they're going to be working in settings like fitness centers, wellness programs, community education initiatives, while many provide services as like solo practitioners as well. So that brings us to part 3, the other professions that are in the nutrition field. So now that we've kind of talked about nutritionists and dietitians, it's also important to mention that there are some other places and professions in this space. Some of them overlap as well. Some of these include health coaches. So these are the people that are helping clients achieve their wellness goals by providing guidance on nutrition, exercise, and lifestyle changes. Health coaches often have a more holistic approach and consider all aspects of a person's life. Next is sports nutritionists. They obviously specialize in dietary needs of athletes and physically active individuals. So they're focusing on optimizing performance through tailored nutrition plans. Next, we have nutrition educators who usually work in schools and community organizations. They're part of public health and they help people practice better eating habits. Finally, we have food scientists, and they study the chemical, biological, and physical properties of food. They work with food safety, quality control, and product development. Which brings us to part 4, how can nutritionists keep clients? So here at ABC Trainerize, we provide nutrition coaches with an all-in-one solution that is gonna help manage nutrition coaching, including healthy habit coaching, meal inspirations, customized sample meals, grocery shopping lists, and meal tracking. You can offer the best possible client experience through meal photos, macro tracking, sample meal plans, and recipe inspirations and daily habits, all in one single app. So you could give your clients hundreds of meal combinations to choose from and keep them motivated to stay on track by easily measuring progress and celebrating their wins. It's all the nutrition coaching you need in one seamless app. So if you want to try it out, you can get started at ABC Trainerize with a free trial. If you have any questions, please leave them in the comments below, and thank you all for coming. We will see you guys in the next one. Bye.